Coughs and sneezes spread diseases. Let's talk about the flu. The flu is a virus that causes a contagious respiratory illness. The flu causes between 3 and 5 million severe cases globally each year. Between October of 2018 and April of 2019, Michigan had 922 flu-related hospital admissions between 5 of its counties, so protection against it is important to individual and community health. It is spread through the air from coughing and sneezing, as well as anyone who has encountered the virus can spread it through touch of either objects or their own face. So who is at high risk? People 65 and older, young children, pregnant women, and those who are medically fragile. Most people who get sick with the flu will not need medical care and will recover in less than 2 weeks. Some people, however, are more likely to get flu complications. The flu can also make chronic health problems worse. For example, people with asthma may experience asthma attacks while they have the flu, and people with chronic congestive heart failure may experience a worsening of this condition triggered by the flu. Also, the flu is more likely to cause severe illness in pregnant women than in women of reproductive age who are not pregnant. A 2018 study showed that getting a flu shot reduced a pregnant woman's risk of being hospitalized with flu by an average of 40%. Pregnant women who get a flu vaccine are also helping to protect their babies from flu illness for the first several months after their birth, when they are too young to get vaccinated. Is it the flu or a cold? The flu and the common cold are both respiratory illnesses, but they are caused by different viruses. Because these two types of illnesses have similar symptoms, it can be difficult to tell the difference between them. In general, the flu is worse than the common cold, and symptoms are more common and intense. Colds are usually milder than the flu. People with colds are more likely to have a runny or stuffy nose. Colds generally do not result in serious health problems. The flu can have very serious associated complications, so remember, every flu season is different and influenza infection can affect people differently. So how do you prevent the flu? Avoid contact with sick people. If you have flu-like symptoms, stay home until 24 hours after the symptoms have disappeared. Disinfect surfaces and wash your hands often with soap and water. Avoid touching your eyes, nose, and mouth, as germs spread faster that way. Instead, cover your mouth and nose with a tissue when you cough or sneeze, then throw the tissue away. Most importantly, get your flu vaccine. This year, the CDC recommends getting it before the end of October for best prevention before the season starts. You should get the vaccine every year because the active strand changes, and so does the vaccine to help protect against the specific strand. The CDC recommends anyone over the age of 6 months to get the vaccine. There are different vaccines options that may be better suited to different populations. For example, there is a higher dose vaccine recommended for people over 65. It is important to be aware if you have severe allergies or are on medication that suppress your illness-fighting immune system, and discuss options with your doctor, because the vaccine protects you, but in turn helps protect those who are not able to get the flu vaccine for various health reasons. Want more information? Visit www.flu.gov or visit your local health department's website. And remember, prevention starts with you.